Okay, good afternoon, everybody, and thank you very much for taking the time to join me on this presentation. The subject today, contingency planning and execution strategies for community livings and healthcare industry. My name is John Noble, and I'm the Regional Vice President of Risk Mitigation for AF-IMAC. I've spent over the last 25 years specializing in the labor dispute management side of the business. The last, just going back 10 years, I've probably put together and assisted with hundreds of community livings and healthcare facilities in preparing for potential labor disruptions, including several actual live exercises where labor disruptions have gone live and helped them manage those type of situations. So the subjects that we're going to be covering today, first off, the strategy or the subject, failing to plan is planning to fail. It's a bit of a cliche, I realize, but so important in our world and in situations that you might be facing potentially down the road. It's critical that you have a plan in place. Sometimes these things can unfold very, very quickly, and it's not something that generally in our business we see that a plan can be put together overnight for something like that, particularly in businesses such as yours where clients need critical care, and it's important that there is some type of plan in place, execution strategies, etc. The program overview to today is establishing objectives, developing a contingency plan, temporary labor, what's involved in that, additional site preparation, and also some suggestions on selecting vendors that you'll need to help you assist in executing your plan. Now, the most important piece is establishing an objective, and it's one thing that you can't execute or even begin strategies around planning without an objective. And we'll talk about two objectives, and the first one is your labor talks, and the second one will be what your operational plan looks like. And as far as the operational plan, objective is key, and it's referring to what your organization will look like during a labor disruption. So on the labor talks side of things, generally what we see is is to get a deal at all costs, endure a strike for a short period of time, or endure a strike for as long as what's required to achieve a deal. And those three scenarios take on certainly different objectives and may indicate how you even prepare your plan. Certainly getting a deal at all costs may minimize your priority for planning, but sometimes getting a deal at all costs don't always pan out, and you end up in a labor disruption. So it is critical that you do plan for that. Your operational plan, if a strike occurs, there's certainly the number one priority is going to be providing critical care for your clients. The availability of resources that you have internally, once you do your position inventory and find out who you actually have available that won't be on the picket line, what skill sets they have to assist, etc. Will you run with partial operations, full operations? Community living, for instance, you might shut down day programs. Some decisions will be made such as that. If you run businesses that help fund and support your organization, decisions must be made on whether those continue to operate and whether you have the means to operate those safely. Will you operate full capacity? And then will all of the above be considered in different phases? Sometimes the things unfold where it may start where there might be, say, no day programs, for instance, or limited access that way. And as a strike ramps up, it's realized that we need to get our clients out and about and doing something. So there might be some strategic planning on how we go about doing that safely. I always hear quite often these common assumptions when I'm meeting with clients. It can't happen to us. We haven't had a strike in 20 years. It's not going to happen to us. We have a great relationship with the bargaining unit. But if I had a dime for every time a done deal didn't get done, I would certainly be wintering in the Caribbean most of the year rather than running around the country helping people get ready for strike. So those calls for us at 11:59 help. We've got picketers showing up. How quick can you be here? Are very difficult for us, and you can imagine how difficult that would be on yourselves. We have everything that we need. I hear that quite often, but certainly as as I sit down and progress in a further conversation, generally that's not the case. There's a lot to think about. It's a very specialized, certainly business in strike preparation. It's not something, some organizations I meet with have never been through a strike. Maybe you're newly organized and unionized, and a lot of times, and it's maybe the union's first strike as well, and they certainly don't know what their rights are, and we want to make sure that certainly everybody is educated and prepared on that end. We don't have the budget or resources, of course, when we're dealing with healthcare and community livings. I mean, that's always the case, certainly, and the thing that's most important is how do we manage our organization, and how do we provide a safe environment for everyone during these type of situations with limited budget, and certainly budget is concerned. And that's where certainly a high level of expertise would come into helping you minimize those costs, but not sacrificing safety and security. You should always be considering the probability versus the consequences when planning, certainly with healthcare and that community living type environments. Maybe the risk of a strike is low, but the result of a strike and not being prepared for it can be catastrophic. I think it's important that that some sort of planning goes into every deadline that you're meeting, and hopefully it's an exercise for naught. But if you do end up in that situation, I think it's critical that you're certainly well prepared. So what to consider when developing a contingency plan? Certainly, what do we need? When you look at your objective and find out what level of operation that you feel you're comfortable in operating, what do we need to above and beyond our own resources to make sure that we can function efficiently and safely during a labor disruption? What do we have in place, taking inventory certainly of your own personnel and what your capabilities really are, and still being able to function as an organization and freeing up some resources to assist. Usually we find in the healthcare side of things that the non-unionized side of the business is usually fairly light in numbers and very taxed as it is. So it's important to do a very good skills inventory on that end. What's justified? Certainly in a situation you don't need to bring an army of security people in, for instance, to manage certain situations. It's not budget friendly, and it also may send certainly the wrong message for your brand and image within the community. So it's particularly important to find a balance of what's justified and what's reasonable. And in order to do that, you need to sit down as a group and certainly establish what that is. What are your risks and vulnerabilities? Certainly with risks with health and welfare of the clients, the folks on the picket line, your image and brand within the community, your assets that need to be protected, all those type of things need to be considered, certainly when you're putting your plan together. And what measures can we take to ensure our clients receive premium care with temporary labor? And that's where it's always important to make sure that you're doing your due diligence, make sure that the people that are coming in are qualified. You're dealing with an organization that's experienced in labor disruption, knows what the different ins and outs and different challenges are, and to make sure that you have a consistent and well well-trained and qualified people coming in to fill in those positions, keeping in mind that you're working under the conditions of a labor disruption. And what to consider when developing your contingency plan. We'll continue with that. Your business continuity planning team, who should lead the team? The one recommendation I have on that is if the person that's leading your team is going to be pinned down in bargaining when it comes down to the critical points, make sure that there's somebody who is second in command or that has authority to make decisions and has authority and a good idea of the plan. You may be locked down in negotiations when certain triggers need to be pressed, so it's important. And the message, I guess, don't plan in a silo. Who should be on that team? Based under that assumption, certainly you'll need to include human resources, finance folks, people that are involved in operations and properties. Security is going to be an important factor. Certainly you'll need your legal folks involved, logistics and folks involved in your programming, all those different aspects, and it may be even more expansive than that. But certainly your key leads in all of those areas will need to be involved in that planning process. It takes a life of its own, and business still needs to be continued. Bills still need to get paid. There might be some special financial circumstances, being able to have more access to petty cash, for instance, credit card limits, that sort of thing changed quicker. All those type of factors may come into place. And of course, dealing with the media, certainly you want to have a spokesperson that's skilled in communications, whether you have somebody on staff or you need to bring somebody in. Communications is going to be a critical part of it. You want to make sure that you're able to respond effectively when required, and certainly not put yourself in a vulnerable situation with something that's been missaid or misquoted within the media. Social media nowadays is a huge factor. Everybody has access to a cell phone, can post things edited the way they want it to be. So it's important that a consistent message is getting out and that it's going through one person and one person only. On the security personnel side of things, should you consider a third party? Certainly, I think that with labor disruption being such a very specialized entity when it comes to the security side of things, it's important that you certainly entertain somebody with a level of expertise in that area, dealing with crowd management and evidence gathering to get injunctions, and that sort of end of things. What role will security play? How important will that communication be with your security providers? How much security will you need and where will they need to be? That's where you'll need to sit down and certainly do a threat assessment and find out what your vulnerabilities are, where your needs are going to be. Or properties that are going to be shut down probably won't need a permanent security presence, maybe just a mobile check. Certainly when there's replacement labor and management crossing picket lines on a daily basis, certainly you want to have security presence there to assist in the management of those picket lines. On that end of it, how many facilities will remain open? I just sort of touched on that. That's going to be part of your objective when you establish that. What are the issues and the tone at the bargaining table? All these things, take on a life of their own. There could be a very political agenda. It could be an agency or organizational specific situation. It could be a union goal that they're trying to reach on a national level. You just happen to be in the unfortunate position of the calendar and end up in the midst of that, and could become certainly a target for more than just a local issue. It could become a political issue that certainly could change the level of activity. Find out where the pickets can legally picket and what you may have to deal with on that end of it. And what evidence will you require for a court injunction? certainly dealing with individuals and organizations that specialize in that field to make sure that if you can't access your property safely, you can't get people in and out to appointments, food and supplies and medication in a timely and efficient manner, or can't access certain properties at all, certainly you'll need to make sure that you've got the right people and the right measures in place to assist in getting those court injunctions and getting successful injunctions that allow you to operate what you have a legal right to do. What to consider, again, we'll continue with that on the transportation side, particularly with personnel. One thing you'll need to establish is who will need to cross those picket lines and how many of them and what the schedules are so that the logistics plan can be organized and it can be smooth and efficient. You want to limit the amount of picket line crossings as much as possible in order to make the situation as safe as possible, as efficient as possible, and also not to agitate or inflame things on the picket line. Will contractors or temporary labor be crossing the picket line? Those will always certainly change the mood. So it's important that you provide a safe means for those folks to cross picket lines to make sure that that's done in a safe manner. How many personnel, what shifts they're working. Generally, what we see happening and certainly suggest to limit the picket line crossings and the number of resources that you need. Generally, it would be 12-hour shifts, longer shifts. Fewer picket line crossings would be needed, as well as fewer resources certainly would be required when you're dealing with that. Will you need marshalling yards? Certainly off-site marshalling locations where people would park their cars in a safe place, board a bus, a minivan, whichever was required, be transported in and then be transported out at the end of the day. That's certainly things that need to be considered. Should personnel be allowed to walk across picket lines? In some situations where we might be dealing with a client that's downtown Toronto where everybody takes public transit, there's no other option there. It's always safer to have people transported and drive across the picket line. There's no opportunity for personal confrontation with the physical proximity to one another. We're all human beings, and sometimes it doesn't take much to get agitated, say the wrong thing, and so it's just a much safer way to do it. But like I said, certainly some instances it's not possible, so certain training and measures must be put in place to make sure that that's facilitated safely and make sure that there's a security presence there and make sure all those picket line crossings are certainly being recorded and documented. What do we need to do in an emergency? You want to make sure that there's plans in place to get medical and resources in if there's a medical emergency, fire, ambulance, that sort of thing, to make sure that you can respond efficiently in a timely manner if there is an incident that needs to be looked after. Should we have picket line protocols in place? Picket line protocol is generally either a verbal or written agreement, sometimes signed, sometimes not, that sort of lays out the ground rules for safe picketing. Sometimes it's agreed upon by the management and the union ahead of time. Sometimes it's done even at the bargaining table if things aren't going well and it's inevitable that there's a strike. You always want to consider, certainly before you enter into any of those discussions, you want to discuss with your legal team. They may not want to engage in a protocol because in their opinion you have the legal right to access your facility, and that may go against their strategy in the event of an injunction. And also you want to include your security folks that specialize in moving people and that across the picket line to make sure that all the bases are covered and make sure that the union does not slip something in that protocol that would hinder you down the road from getting access to your facility and getting people and supplies in and out. The other one, will the police help employees get across picket lines? No, they treat labor disruption as a civil matter. They won't negotiate times, they won't open up picket lines, and that's pretty consistent straight across Canada. It's considered a civil matter. Certainly if there's a breach of the peace, they'll respond to that. And one of the most critical parts of an injunction is the first thing that you need to do is prove that you haven't been able to gain police assistance. And that part will be easy. In our business, we have those discussions ahead of time, develop those lines of communication with the police. They know we're going to be calling, they know why, and then also set up that we're not going to call 911 for picket line delay, but we do expect a immediate police response if there is a legitimate emergency, and we will certainly use the 911 for those instances only. Transportation of materials and supplies. Will you be able to get supplies, food, and meds in? Certainly, yes. We have had an instance in the past where there was a temporary disruption of meds getting into facilities. It was a matter of communication between legal and management and the union, and also it was a very probably a strategically unwise move for the union to do something like that in the public eye. But with that being said, that things do happen. People do behave in a manner, in that mob mentality that isn't necessarily the way we would expect them to behave, and you need to have a plan in place to make sure that those supplies and food and meds can get in. Make sure that employees are able to leave for appointments and activities. It's important that there's a line of communication that's set up so that if somebody does need to leave, there's a schedule and people know they need to get in and out, and if it's an emergency, it needs to be a call on how to get the most efficient response and most organized response to those type of things. Temporary labor. Certainly one of the areas that unfortunately in the labor disruption side of things and healthcare, there really isn't an option but other than to use temporary labor in most instances. You're dealing with the critical health care of individuals, and it's not like a production facility where you can stockpile a product and shut the lights off. You need to actually provide a very critical and necessary care, and in order to do that, there really isn't any option. So one of the things that you're going to need to do is develop a plan in, what resources will you have available, what resources will you require, will you need an external contractor, how many will you require and what shifts. It's important that you're going to need to do an inventory of how many management staff that you have, skills inventory, who's capable. Generally what we see in, say, a group home setting, for instance, on the community living side of things, maybe one management staff per group home operating the day shift. And generally what we find is after the first little while, once things get running smoothly and everybody's comfortable with the level of care that the temporary workers are able to provide, usually the management staff can fade out and get into their own roles and even have some very necessary relief time from that. But it's important that you know what your available resources are, and keeping in mind that you still have to do your day-to-day business in running your organization under those circumstances. Training and orientation requirements. You need to leave yourself certainly enough time in your planning to make sure that you can provide any necessary additional training. Usually what we do is deploy resources 72 hours ahead of a labor disruption, and that allows for some additional training. It also allows for an orientation period where you folks can get acquainted with the individuals and match them up best with the clients that they're going to be providing care for. That's end of things. And if you're an agency other than, say, community living, for instance, and it's nurses that are required, you certainly want to make sure that everybody is trained in your policies and procedures and has an understanding of what's expected of them. Generally, the recruitment of temporary labor is a 30-day process. That's a number that certainly over the last 30 plus years that AFIMAC is in business has found that in order to do the proper onboarding, the background checks, the initial qualification process, getting that process to the client, having them finally signing off on those individuals, that's a 30-day process in order to make sure that the proper skill set is deployed. And we also understand that retaining people longer than 30 days is difficult. So it's, you know, that's sort of where that magic number has come out of. The last thing that you can afford is to be scrambling and trying to recruit temporary labor a week or so. This time around, I know in the community living side of things, the level, and we've been recruiting for agencies consistently over, you know, certainly a long period of time, but through the last year, we've found that the level of resource isn't quite as plentiful as it was, you know, as even a couple of years ago. So, you know, depending on, you know, there's a number, certainly, of contracts, as we all know, coming up in March in the healthcare industry. So if it's temporary labor that you need, certainly you want to make sure that you've secured resources very early and with the guarantee that they'll be able to provide those resources, and somebody who's certainly very well tuned in with the industry and the market and what the availability is. Make sure that's all the licensing and tickets and permits, and that end of it, make sure that that's well spelled out, and make sure that the folks that are being recruited are coming on board with those requirements, specific needs. It might even be specific needs, whether it's feeding tubes or administering medication, high behavioral needs, those sort of things should all be considered and certainly should be presented to your vendor that you're using to assist to make sure that they are recruiting for your specific needs. What can you expect from the pickets if you use temporary workers? Certainly the environment changes. When you're dealing with replacement labor, that always changes the environment. It certainly elevates the mood. It creates some different challenges. But as I said before, that's not something that you're able to avoid. So it's important that you have the proper skill set and certainly professionals in to help you assist in that process, and certainly educated in what your rights and certainly what you need to, or what you can expect to manage through under those circumstances. The current state of your industry, and I talked about that as far as supply and demand goes. This time around, certainly it's something that needs serious consideration, and to make sure that that discussion is held and make sure that there's a level of comfort in that. And even, you know, playing that wait and see game, I think this time around is going to be very difficult to do if I'm speaking specifically to community livings in this situation. Choose a provider with a proven track record to avoid those empty promises. It's very easy to say that, yeah, we can get 55 or 50 or 30 replacement workers, but if there's 4 or 5 agencies that are fighting for 400, you know, you want to make sure that that the provider is able to meet those needs under those very difficult circumstances. Have your client profiles and job descriptions ready. Make sure that they're available and at each group home or facility where those folks are going to be. I always, you know, suggest that you have sort of a kit prepared or books with all that information that's available, so that folks that are new to that home and those individuals have easy access to that information, or a manager who's put in a situation that they haven't been in a long period of time. Maybe they're working in a different part of the business and are now going back into that role and don't know the individuals, that sort of thing. Make sure that all that information is readily available and prepared well in advance. Demand daily reports from your provider to ensure that they're on track. Make sure that they're providing you daily updates on the process. Make sure it's very transparent so that if something needs to be escalated, to make sure that you meet those deadlines, that those are being done in a timely manner. Certainly stick to those realistic timelines. Don't cheat that 30-day window. Unfortunately, we've seen in the past where, budget's always a concern. We don't want to spend that money to initiate that process and then, creep inside that 30 days. And then that magic number gets really, really difficult. And you end up with some deficiencies, which makes life very difficult to manage through initially. And you certainly want to be on the right foot when these type of things take place. Certainly you want to ensure the safety of all temporary workers. Make sure that they're being transported in a safe manner. You're not asking them to walk across picket lines. If that's the case, you're probably not going to keep them very long to put them in that difficult situation. And make sure that your vendors and contractors that you're using are being upfront with the replacement workers and that they know what they're getting into in advance. Otherwise, after the first day of having to go through a picket line and all that's involved in that, you want to make sure that everybody's back the next day, or you'll be dealing on a regular basis with deficiencies and scrambling to get people in those positions. And then, as I said, prepare detailed client profiles and related tools and have them ready at each location. Effective use of management, I spoke about that earlier. Make sure that your non-union staff is there to support the temporary workers. At the beginning, maybe it's one in each group home. Make sure that if nothing else, they're available and supporting and helping where required. And what you'll generally see as you get into these type of scenarios, 2 or 3 weeks in, generally that can be diminished, and you'll find that things are running quite smoothly and less taxing, certainly on your management folks. Off-site orientation and training prior to the strike deadline, generally 72 hours, as I mentioned earlier. There would be an off-site location booked, and then those type of sessions would be put into place. Ensure that your provider has a time tracking and communication system in place. When you're dealing with a number of replacement workers at different locations, you want to make sure that there's daily sign-off sheets being signed off on hours of work. Certainly the last thing that you want when this thing is over is having to go back and try to look at timesheets and who was there and going through bills and invoices and try to make sure that what you're being billed for is accurate. The best thing to do is have that system in place so that it's a daily sign-off. Your provider signs off, you sign off, and that makes life very simple. Make sure that that system is in place. How long can you withstand a shortfall in manpower and have strategies in place to guarantee rapid deployment? We're all human beings. Certainly, people get hired, they don't work out, they're sick. They may not meet your specific needs, that sort of thing. They may unexpectedly need to leave. So it's important that there's a strategy in place and it's well prepared in advance, and you're aware of what that time frame is to fill those holes and those deficiencies. And generally, it's important that there aren't any deficiencies and that's a quick deployment, but you need to know up front how long it's going to take so that you can ensure that the care for your clients are met. And then, as I said earlier, I can't reinforce enough, do not take the risks on the timelines. If something develops, as I said earlier, this never happened to us, and it does, sometimes things can turn on a dime. Lately, we've been seeing the union strategies is to go along through negotiations, knowing that your biggest challenge is the replacement worker side of things. Will make it believe that everything is fine and dandy, and then all of a sudden throw you a curveball at the last minute, knowing that you don't have enough time to get those resources. So be aware and be well prepared in advance. And don't take any of that stuff for granted, certainly when it comes to the health and welfare of your clients. Additional site preparation, you might need to put up fencing, repair fencing, certainly locks may need to be changed, no trespassing signs set up. If some of your locations have surveillance cameras, make sure that they're functioning. Certainly you'll want to make sure on that end that your locations are safe and well prepared in the event of a labor disruption. Make sure that all the lighting is adequate. Make sure that anything that's in disrepair is repaired. As I mentioned, lock and key controls, who has keys to what, combinations to what, fob cards to things, they'll all need to be deactivated and changed to ensure that those folks don't have access to your facilities while they're in a labor dispute situation. As I said, we all want to believe, and and generally it's good people that are employees of yours, but good people do behave badly under those circumstances. I did a strike that involved in the healthcare business a number of years ago in the Hamilton area, and there was 200 ladies involved in it, and there was one gentleman, picket captain, and I remember going there, and it started out as one big party, but as 7 weeks dragged on, I did up more incident reports and had more to deal with in that labor disruption, just based on those circumstances alone. So it's important that we would like to think the best of people, and it might not even be your folks. We've seen instances where other unions have used your labor disruption as a platform, have thought that they were providing assistance in the picketing and support, but have actually created dangerous situations. And you need to be prepared for all of those things. Make sure that, as I said, your CCTV systems are in working order. They meet your needs. Sometimes during a labor disruption, those cameras may need to be adjusted because now instead of looking at a doorway, you may want it to be pointed out to where the picket line is going to be, and those type of things. Make sure that the recording devices are all working and functioning properly, and there's somebody managing all that and helping with the security folks in getting any information that might be usable and certainly critical. It's important that the continuity of that evidence is maintained, so make sure you work with your security folks in assessing those situations. Make sure that your access control and any alarm systems, and alarm response providers, that sort of thing is all taken care of. Make sure you're well aware of who your police contacts are, which force is there, what's to be expected. Make sure that level of communication is done with them, and certainly your security folks will be involved in that process as well. And certainly your fire department contact goes without saying, but keep in mind that you see picket lines all the time where, they want to bring burn barrels and things like that. Make sure that, those city bylaws and things of that nature are being enforced. We understand that it's been difficult to integrate within the community, and now that you're there and have well established and good relationships with your neighbors, something like this can sour that. And certainly you want to be as good a neighbor as possible under those circumstances. So work with the police and fire to make sure that those type of things are being enforced. Signage, where where your boundary lines are, so that the security team and police can enforce trespassing, that sort of thing. Know what your facilities and boundaries are. Legal representatives, who and how will you communicate with them? It's going to be critical that they're certainly in the loop, that they're going to require information from you and from the security folks. Make sure that that's well established. As I said earlier, the media is going to be a big piece. You'll need a spokesperson there, and I think it's critical now that you have a system in place to monitor social media, get an idea of what's going on. might be rallies that the union are planning, some of their strategies. You're able to keep what's going on, and you also want to make sure that your image and brand in the community and the media is being upheld to the standard that you want it to be. So that's critical that those type of strategies are in place. Make sure that the communication with your suppliers and customers, clients, family, you want to make sure that there's a procedure in place to notify them, keep them posted on what's going on, and regular updates. And what I found in doing lessons learned activities with clients after a labor disruption is one of the biggest issues that they had was lack of information. And what I found is even to provide an update, to say there is no update, is enough to keep people satisfied and on track and make them feel better in those type of situations. And also don't forget about your internal staff. It's going to be very critical to keep them positive and upbeat. They're going to be working longer hours under difficult situations. Make sure that the communication with them is positive and it's good, and they're getting in the information that they need. Make sure that your key stakeholders, your board, that sort of thing, know exactly what's going on. Make sure there's no surprises. You want to be able to manage situations and crisis immediately. When it occurs, you want to have an effective response, and in order to do that, communication is always critical. Make sure that accounting and finance, there's going to be, as I said earlier, some different strains and stresses on finance. There's going to be some additional requirements, some out of the ordinary measures that might need to be in place. Make sure that all those are considered in advance so that those measures are in place to get people paid and get things when you need them, to make sure that life remains simple on that side for you. Make sure that this is important, and one of the things in discussing the community livings that I've dealt with after a labor disruption, and I know that, and not just community livings, but healthcare facilities in general, is it's important that you have a strategy in place to keep your management and temporary staff charged. Make sure that their energy and they're, have some sort of opportunity to recharge the batteries and to get a break and some positive, even if it's, providing some type of thing that, and certainly, if you need any suggestions, don't hesitate to email me on those type of things. But to keep the management team and the temporary staff upbeat and positive and refreshed as much as possible. They're going to be working longer hours away from home, dealing with stressful situations. And it's important, not only for during the event, but also your management team. You want them to be recovered and be able to recover as quickly as possible. And from a mental health or physical standpoint, after these events, the care doesn't always, doesn't end during a labor disruption or when the strike ends. Have those type of things and think about them in advance. Consider in advance ways to provide some sort of client outings. This has proven effective in the past. It does take some planning though, facilities and transportation. Maybe it's one location where everybody gets together for one day of activities. It's probably something that you won't be able to plan until you end up a couple weeks into a labor disruption. But it's very important that you consider that and have those measures in place, or at least be thinking about how you can logistically manage that. And don't hesitate to involve your security provider. They'll certainly something they deal with on a regular basis and can add some good guidance and suggestions on that side of things, and certainly provide the resources to make sure that happens. And on selecting a vendor, who should I consider? Certainly, whether it's companies or individuals, what I say on this end is just do your due diligence. It's very easy to put together a really nice brochure, say that you've helped people. Maybe you've helped them sit down in a boardroom and plan, but have you actually been involved in the execution of a real labor disruption in your industry? Certainly you have some very unique needs and requirements. Make sure that there's certainly a history and a positive history with the group, and make sure that you just do your due diligence on that end.
The one thing about the healthcare industry is that they have a very strong network, sharing advice and sharing, you know, war stories, for lack of a better term, experiences. You know, share that information, find out what worked and what didn't work for them. You know, what resources they used, any difficulties they had, or any, you know, good experiences they had, that sort of thing. Get a, you know, real industry reference that's in your geographical region, certainly. And as I always say, you know, prepare for the worst and hope for the best. That's kind of the motto in our business, but it really is something that you need to take consideration in, certainly when you're dealing with critical care in the health industry and providing clients with that critical care. You know, unfortunately, unions have landed in your industry and they're there, and labor disputes do happen. So it's important that you have a plan in place. It's much easier to, you know, to have a plan, and when those things unfold, and try to scramble and get something done at the last minute, which allows a potential risk for your employees and clients. That allows the union to get their foot planted first, which makes it a very difficult way to start a labor disruption. You want to be able to manage it efficiently from your end. So as I said, you know, my name is John Noble, and I appreciate everybody taking some valuable time out of your day. I hope some information that I shared today was of value. If you have any questions, don't hesitate to email me. You can reach out to me by phone anytime, and I'd be happy to answer those questions. Or if your organization wants to sit down and discuss your planning needs, please don't hesitate to reach out, and I'd be happy to stop out and discuss that in more detail. Thank you very much for your time.